Welcome. Today we're diving into the world of rheumatic heart disease, or RHD. This serious heart condition affects millions globally, often silently progressing until significant damage is done. Join us as we unravel the complexities of RHD, exploring its causes, impact, and what can be done to prevent and manage it. Rheumatic heart disease is, at its core, a complication of acute rheumatic fever, or ARF. ARF is an inflammatory condition that develops in response to a strep throat infection, the same bacteria that causes strep throat group Streptococcus. When strep throat goes untreated or undertreated, the body's immune system can mistakenly attack its own tissues, leading to inflammation in the heart, drains, and skin. It's this misguided immune response that sets the stage for the development of RHD, primarily affecting the heart valves. Let's break down how RHD impacts the heart. The inflammation caused by ARF specifically affects the heart valves. Over time, this inflammation leads to scarring and thickening of the valve leaflets. This scarring can result in two main problems: stenosis, where the valve narrows, making it difficult for blood to flow through, and regurgitation, where the valve doesn't close properly, causing blood to leak backward. Both of these problems force the heart to work harder to pump blood, eventually leading to heart failure. The mitral and aortic valves are the most commonly affected, although other valves can also be involved. RHD remains a significant public health concern, particularly in low- and middle-income countries. While less common in developed nations thanks to readily available antibiotics and improved healthcare, it disproportionately affects children and young adults in regions where access to healthcare and prompt treatment of strep throat are limited. Indigenous populations in developed countries also have a higher incidence. The global burden of RHD is substantial, contributing significantly to cardiovascular morbidity and mortality. The signs and symptoms of RHD can be subtle initially, often developing years after the initial episode of RF. Common symptoms include shortness of breath, especially during exertion or when lying down, fatigue and weakness, chest pain or discomfort, palpitations, or feeling like your heart is racing or fluttering, swelling in the ankles and feet, known as edema, and sometimes lightheadedness or fainting. The specific symptoms will vary depending on which heart valve is affected and the severity of the valve damage. Diagnosing RHD involves a combination of factors. A thorough medical history, including any history of strep throat or rheumatic fever, is crucial. A physical examination will help the doctor listen for heart murmurs, abnormal heart sounds caused by turbulent blood flow through damaged valves. An electrocardiogram, or ECG, can assess the heart's electrical activity. An echocardiogram, an ultrasound of the heart, is the gold standard for visualizing the heart valves and assessing the severity of any damage. Blood tests may also be done to look for evidence of past strep infections or inflammation. While RHD can affect any of the heart valves, the most common classifications depend on which valve is primarily involved and the type of damage present. We often speak of mitral stenosis, where the mitral valve is narrowed; mitral regurgitation, where the mitral valve leaks; aortic stenosis and aortic regurgitation, affecting the aortic valve, which controls blood flow from the heart to the body. Many patients may have a combination of stenosis and regurgitation in the same valve, or involvement of multiple valves. The treatment and management of RHD focuses on alleviating symptoms, preventing complications, and slowing the progression of the disease. Medications can help manage symptoms like heart failure, such as diuretics to reduce fluid buildup and medications to control heart rate and rhythm. Antibiotics are crucial to prevent recurrent strep infections and further heart damage. In severe cases, surgery may be necessary to repair or replace damaged heart valves. Valve repair is preferred when possible, but valve replacement with mechanical or biological valves may be necessary in certain situations. Lifelong monitoring with a cardiologist is essential to manage the condition effectively. Prevention is the cornerstone of combating RHD. The most effective way to prevent RHD is to promptly diagnose and treat strep throat infections with antibiotics, typically penicillin or amoxicillin. Public health initiatives focused on improving access to healthcare and providing education about strep throat and rheumatic fever are vital, especially in high-risk populations. Secondary prophylaxis, which involves regular antibiotic injections or oral medications, is crucial for individuals who have already had ARF to prevent recurrent attacks and further heart damage. The prognosis for individuals with RHD varies widely, depending on the severity of the valve damage, the presence of other health conditions, and access to appropriate medical care. Early diagnosis and treatment can significantly improve outcomes. Unfortunately, untreated RHD can lead to severe complications, including heart failure, stroke, and infective endocarditis, a serious infection of the heart valves. Ongoing research is exploring new strategies for preventing and treating RHD, including the development of vaccines against group A Streptococcus and more advanced techniques for valve repair and replacement. The goal is to reduce the burden of this devastating disease and improve the lives of those affected. Thank you for joining us on this exploration of rheumatic heart disease.